Okay, guys, welcome to the session of Marrow, which we kind of regularly been doing now. This is interview with the toppers, and this time we have got Dr. Shubham Jain, who is one of the toppers in this INISS. Before we go deep into what he has to say, uh, over the past maybe 3-4 years, we have been conducting multiple interviews, and what I've understood is that even though there are a lot of common grounds in a lot of interviews, but in the end, each interview is unique, and each person has to give a very unique and very relevant insight on how they prepare and how what it takes to crack this exam. So let us start this interview without wasting anybody's time. And I'll start with giving a great and hearty congratulations to Dr. Shubham Jain. Congratulations, Shubham.
Thanks a lot, sir.
So, how do you feel now? What do you feel? I mean,
sir, everyone's dream is to go into the most elite institute of India, and that too in super specialty courses where seats are few and competition is kind of difficult, though people are less, but it is very neck to neck. So it took one day for me to realize that I got a rank in which I could get AIMS Delhi. So yeah, finally I had a belief, but seeing it come to reality, it takes a time to believe.
That is great.
Congrats. Good. Congrats, man.
Probably that is the reason, not probably, that is the exact reason why we want to talk to you and to help people coming after you and your juniors how to practice exam. Okay.
Yes.
So before we go into that, can you just tell a little bit of yourself and your chronology of how many preparations and all those things you have done?
Yes, sir. So basically, my name is Shubham Jain. I belong from Agra hometown, Uttar Pradesh. I did my undergraduation from King George Medical University, Lucknow, 2014 batch. And after completion, with internship only, I cracked NEET PG. And I got into admission in MD Medicine in BHU, IMS BHU, Varanasi. And after that, this was, as attempt was third, but the proper preparation is was my first attempt for INA SS Gastroenterology. And I secured a rank of AIMS rank of 4 and CML of 17. I was also shocked seeing 17 to 4 after interview. That was also a shocking news. But yes, interview does matter. Now I know that after this rank.
Good. Great. So, can you tell us a little bit about how you managed it? Because you said that after MBBS, you straight away got into PG. Now, after
Yes,
PG, but you took two extra attempts in 6 months apart. First one was along with your final year preparation. Now,
yes, sir.
You managed to crack your PG in the first attempt while doing internship.
Yes, sir.
Here, what did you feel the difficulty was? I mean, obviously, difficulty was one step higher. That is the reason why you could take another one.
Sir, yes, sir. I got a NEET SS rank of 255 also with first attempt only. So the thing is, after MD, there is a very different scenario which we have after MBBS.
Correct.
Because now what you do in life should be what satisfies you.
Correct.
You have done MD medicine. Now you are going more specific into topics or subjects. So
yes, true.
We should be very cautious about it because we can't jump into something which we didn't want it to do and end up like destroying our life or something. And again, that vicious cycle occur of reattempts, changing subjects. So it is a very, I would say, cautious thing. Whether take one attempt, two attempt, doesn't matter, but it should be right what you wanted to do. That's my view.
Excellent. It's very well said.
This I feel is the most common part of all the toppers. Figure out what you want to do and understand what is the pros and cons of it, and you like it, and then you go full on with it. The first and the most important point of getting into a DM seat is the decision that you want to get into this branch and the clarity you have. The earlier you have a clarity, the faster you clear the exam.
So at what point during your MD or after your MD did you decide to become a gastroenterologist, or when did the field fascinate you? At what point? Because that happens to different people at different times.
Yes, sir. Thing is, like we are there's less exposure to gastroenterology per se in MD. To be frank,
True. All of
we
us
don't
face
have
that.
any idea. We always have a exposure of neurology,
And
cardiology,
cardio.
the famous
True.
subjects. Then endocrinology also, but gastroenterology is one of the thing that we are least exposed to.
True.
The thing which fascinated me about gastroenterology is the learning curve. I wanted a branch where there's a learning curve, a good like a good long learning curve. Because whenever I feel like whenever you're going into DM, you are spending 3 years. So in those 3 years, you should get an edge above your MD. This
Okay.
branch I felt is something which sets you apart from a MD medicine, because there are something that MD medicine also practices. And
That's a
cardiology
very
and gastroenterology,
unique way of looking at things. Good, 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 good.
yeah,
Very few
yeah.
people think of it this way.
So
That's very
cardiology
noble.
and gastroenterology are two
So you're
subjects.
saying that. So you're saying that physicians might be relatively okay in managing cardiology and neurology as a practice, but a gastroenterologist is always required in the field of
Yeah,
GI
yeah,
and hepatology. That's pretty true,
yeah.
actually.
Yes,
That's not.
I don't,
I know that's true.
and I'm not being like unbiased or to any branch and all,
Yeah.
but
People might think that we are being
No,
very arrogant in saying that, but it's actually true.
yeah,
this
Because
specific
even
realization came to me after I started doing my DM, not
true.
before. We're actually quite
Yeah.
early into that.
No, even during our MD, it's, I mean, for me, it was like that. I mean, it was always cardio and neuro. And I was exposed to Schlesinger, and, I found it fascinating. But as far as day-to-day practice and work was concerned, it was always cardio, neuro, very little, exposure to gastro. So that's what you're saying is very true. So at what point during your MD did you figure that out? Was that during your,
actually, actually when I was in my third year,
okay.
I in my institute there was a lot of exposure for hematology, and cardio neuro. So, but gastroenterology, since BHU has DM gastro good there, so there was not much cases admitted to our wards. So whenever
Okay.
I used to go
Yeah,
for,
yeah, yeah.
okay, whenever
True.
whenever I used to go for references to ask my seniors as are there,
Yeah.
gradually, yeah, things went on track. Yeah, this is a branch which is very different, and there's different
Correct.
aspect to this
Correct.
branch.
Oh, yes,
And when
yes,
I
yes.
started learning core gastroenterology, that then I felt that I haven't read about it. This, like for example, peptic ulcer, which is a very common topic. But when you read it in depth, it is not just peptic ulcer. There's so much to read about just peptic ulcer. So then
Correct.
I went on reading, and second thing, it is more of now surgical also. There's a surgical point into the subject. So some may not like it, some may like it, because some may want to stick to a core medicine subject. But since this thing fascinated me that there's a surgical aspect also this branch, and there's now overlap for many cases between surgical gastro and radiology, and plus radiology part was also there. So it is kind of a blend of three things ultimately.
It's
So
very
this
rewarding
way,
listening to this guy, because it took me during my DM phase to figure out that, I have to start looking at patients from a surgeon's point of view also. But
Correct.
before you get into the field, the fact that you have that understanding will take you places, because that's, for anyone out there listening to this interview, thinking about a field of gastro or hepatology, this is a completely different ballgame, because you need a surgeon's point of view to become a good gastroenterologist. I'm not just talking about procedures. Even the medical gastro cases or liver cases that you look at, you can't just look at it through a physician's eyes. It's not arrogance. That's how it is. You have to start behaving and looking at patients through that surgical lens also. It's very impressive that you have already figured that out.
And a similar amount of aggression, not too much, but yes,
Yeah, not too
similar
much,
amount of
but
aggression. Yes.
guarded level of aggression is required. You
yes,
have to take a step
yes,
forward. It's you
Yes.
can't just wait for things to happen. You have to anticipate and act. That's obviously, whichever institute that you're going to join, they're going to push you into, even if you like it or not, they're going to push you into having that sort of a mild aggression, but a very controlled sort of aggression in your practice.
Yes, exactly.
yes.
Okay, that's great. That's good to know. Now let's move into more important part of the interview, where how did you prepare?
Yeah, what was your preparation strategy?
And how long
preparation strategy? See, for preparation strategy, there's a 2 or 3 points which is very must, I would say. First is intent. There should be an intent that you can crack it. Second, there should be a great not many mentors, 1 or 2 mentors who have done that thing. For example, my seniors who have cracked exam under 5 rank, under 4 rank, under 10 ranks in previous exam from my KGMC and BHU, both I have seen from my UG days. So it's kind of a doable thing. And one thing I would like to add, that there's a myth that if you are not from a good institute, you cannot crack good exam in INSS rank. There's kind of a belief, though there's some aspect, but if you have an intent, anything can happen, because there are people who are cracking good rank.
Excellent.
I'm from BHU, Central City, but there may be more institute from peripheral aims also must have given. Many other candidates must also have given.
Yes.
So
yes.
I
And that
feel
trend
that
is
intent is
changing.
important.
Yes.
Yeah. I've seen my seniors from KGMC and BHU cracking ranks. Uh, Even my NEET PG time also, after I gave my NEET PG, many people don't used to prepare for at that time PGH Chandigarh multiple choice based answer based paper. But my one of my senior cracked under 10 rank, and so it gave me a belief that things are doable from the very same institute where he was also studying and I was also studying. So intent is the far most thing, because if you don't have intent, you can't go long. Second is good mentor who has done this the same thing. And third is that path to success is not defined. It is kind of tailor made by everyone for their individuality. For example, some take more time to read a topic, some take less time. So first of all, I realized that I wanted to give more time. For example, somebody with more intelligence could handle the same time with many other things. So that is also what you should have realization, and you should accept it. Yes, I am lagging in intelligence, but an extra 1 or 2 hour in a day or extra effort can change things. So that is the thing. Self-realization, mentor, intent, and regarding notes and coaching strategy, that everyone, this thing is available to everyone. It is not like I am having some extra. The thing is how you make them their own. That I used to say that your note should feel like your own, not for coaching, that it is given by someone. So I used to edit it, uh, put points in it from questions, whatever sources, Sazinger tables. So I made my notes look my own, not like someone has given me. So that whenever I revised it, so it got into my head easily. So yes, modifying the notes according to your whatever say your strategy and all is very important. Not just what is served from your side. For example, what you teach us, we can't just we have to
You have
like
to make it your own.
modify
Correct.
or the other according to our like. Yes, sir.
So in
It's
this
all.
journey, how do you think Marrow helped you?
Marrow helped me in getting my, like, for example, starting gastro. Where to start? First thing, where to start? Such a great question. Schlesinger is a big thing. Who haven't read Schlesinger, to start it, then plus gastro, as I told, is no, there's less exposure. You feel what is the subject? I'm not getting any kick from reading it thing. So
Correct.
the concept of videos is that when you see a video, you see what it is there in the topic, what is there to be, what will you see when you will read. So seeing the videos, then reading the topic from the book, grasp more.
Excellent.
Second, the notes help a lot. Obviously, now the world has gone so far that now at your time must have been, sir, that they were not available resources so much. Now resources are there, notes are there, made thoroughly. So yes, notes helped a lot because we had something to study in our hands. So that is, but ultimately we should modify it. If
Exactly.
we don't modify, they will be like someone else note you are reading. So yes, we have a base. Marrow helps in providing a base in which you have to build your own further.
Good. Good. Very good.
Great. What do you think about the mock tests and all?
Regarding the mock test, in NEET PG time, I used to think mock tests are very necessary. But when I came to SS, it was not like that. I gave SS, I got good rank this time. I was getting good rank. I was so confident. But SS is different thing. For it cannot be judged on mocks because what they're asking for. Since I have given 3 exams, there were 3 different types of exam. To be frank,
Ah,
somebody
okay.
more of some there were weightage for more legal question. Sometimes there were more weightage of one liners. So this the topics can be predicted, but the type of question still it is
You
up to
can't
them.
predict.
So how they can ask that same thing 10 times in a 10 different way. So mock tests are good, they should be, but rather more focus should be on what backing your MD knowledge, which you have gained in 3 years, because the general medicine part was there in 30 questions. You cannot prepare
Exactly. That's also very
how much
important.
medicine. So I just backed my MD knowledge and
Okay.
see seen a few Harrison tables, but didn't do much for medicine. So I backed my knowledge which I gained in my MD. So that helped me a lot.
So
And gastrology, so basically mocks are there, but in SS I don't feel that we should be dependent on mock ranks, or we should be
Okay.
felt disheartened or judging our like
Correct.
uh,
basically,
ourselves.
you would say that it is more important here that you do a concept-based learning than a mugging-based learning.
Yes, sir, exactly,
Okay.
exactly, sir.
And getting concepts from a book reading. I mean, when we were preparing this, Schlesinger was the only thing that was there that looked like a mountain to us, literally. I mean, it's like so huge, and you don't know how to wade through it. But I mean, till now, I feel that every time I reread this book, there is something which I get different, because every time you look at a topic, it's in a different eyes you look in a topic. You
Yeah.
every time you use a little different perspective on that same topic, even if you use the same exact line.
Yes,
So
sir.
that's what I
Yeah. I
also
think
have always try to
correct.
emulate. Try to give the concept. The building up is up to them, because then only you can face the googlies. Anybody can face the one-liners, but it's difficult to face the googlies.
Yes, sir,
Yeah.
exactly.
So reading Schlesinger after listening to the classes also. This is what I also always tell during my classes. I think if you put in a little bit of an effort to go through Schlesinger after the classes, it's sort of a double confirmation. Stuff that you listen to, you're also reading. I think especially for central institutes, you have to go that extra mile. Is what I feel. I know things have changed a lot, but if do you agree with that? That reading standard textbooks also makes a little bit of a difference.
It's difficult
Uh,
because of the amount that they have to prepare. That is the only problem. Very good idea, but the amount
So
they
in
have to
your
prepare.
case, so Schlesinger, you just focused on the tables, or did you go through it?
uh,
Did you get time to read through Schlesinger?
Actually, for first 2 attempts, I didn't got time to read.
Okay,
During with the first attempt which I give with my MD, I just hardly for
I know
month I
that's
prepared.
not possible. Yeah, it's not possible. But okay,
And in the NEET, the second attempt, also it was along with NEET PG, NEET SS. So there was some I was not prepared up to well, but then I focused
fine.
Schlesinger based only, because that
Yes,
is the thing. For example, if Bible for medicine Bible is Harrison, for
true.
gastro it is Schlesinger. So
So
Yes.
how did you
so
manage to? How did you go? You initially you said that notes was your base. So how did you fit your
yeah.
Schlesinger into those notes?
So initially, yes, I started with the tables, charts. On first 2 day of my preparation, I just opened my tab, made a file of all the images, all the table, whatever flowchart was there. I made a
Oh,
separate files
interesting.
for myself.
Nice.
I clicked all the screenshot of the all the flowcharts, all the
Okay.
images, and images
Okay.
histological images separate, and tables separate. So first of
Ah,
all, I did. After that, I got an idea that what is there. Then I read notes. But frankly speaking, I didn't read Schlesinger whole or very vast. But I was there, especially in those topics which were frequently being asked.
frequently
Uh,
being asked. Yes.
Yeah. For example, pancreatitis, acute chronic pancreatitis, alcoholic hepatitis is
Yes,
these few topics
IBD.
which ask somewhere or the other. So I focus on that. And there are some topics which don't require depth reading of Schlesinger. Notes are enough, which fortunately have been given to us in a great manner. So for
Correct.
some topics are enough, and some topic require depth reading.
Yes, good, good, good. Okay, that's
Okay.
very good. You're sorted. You are always very sorted in your training. That's very good. People should have this kind of a streamlined sort of analysis before planning for. That's very good. So you had good mentors, I would say, and you had Marrow, and
Yeah,
then you had good seniors also. It's very clear.
yeah. I had seniors from my second year of MBBS.
Okay,
I had two seniors. I would not name them, but they were my first guide and first
okay.
mentors. They just told me one line that you have entered your MBBS. There's a long way to go, longer way to go. Learning curve is not which is you are seeing today. It is very beyond. Once you will go, so don't just lose your frequency of learning things. Be in that range always.
So where do you
Now that
see
I just
yourself?
went.
now
Where do
that
you
you're
see
saying the
yourself?
same thing,
Yeah,
probably that is the same two lines I would also like to tell you. You who have still got a
a
long
long
way
way
to
to
go.
go. No, but where do you see
Yeah,
yourself 10 years from now? I'm sure you
I
have
would
some
be.
kind of idea.
Yeah, I'm. My idea is that I want to do something for the subject. For
Okay,
example, there are two types of clinician. One which connects with the people, like treats the people. People know him, and there are other kinds of physician which we in our community know that they have done great things. For example, someone has given a study of treatment. Now this treatment is being given to many, but that person is not giving. He has made a base. He was a pioneer of something. So that those people fascinate me more rather than a person who is seeing 1,000 patients or 100 patients, like 500 patients.
that's very good.
So
In that
You want
case,
to be
you've gone to the
respected
right place.
by your peers. Good, that's very good. Yeah,
Correct.
that's
I
exactly kind of metal that is expected of people who pass out of central institutes, because people can be popular, can get popular with patients based on a lot of things. That's not necessarily your intellect. It can be just the way you talk and you connect with people. But to be respected amongst your peers, people in
Yes,
your
sir.
own field, I think that
Yes,
should be the humble aim of
yes, sir.
people in our field, or any field for that
Yes,
matter.
sir.
It's very good.
Yes, sir. One point has to it that whenever I used to go to conferences, national conferences, I used to see people at the stage presenting papers from international and national. So I just imagine myself always there on the podium someday
Good. Yeah.
presenting some study here or maybe somewhere else, a better place. So I used to
Yes.
imagine myself there more of the
Yes.
in
Those days are
podiums
waiting
and
for
all.
you. Don't worry. Yeah. Yeah.
Yeah, they are
You
not
will,
far.
Yes,
they're there, right in the taking for you. Yeah. So Tarun,
yes,
anything else you want to ask?
No, I think we have covered a very decent
Yeah.
approach.
Yeah. Yeah.
Yeah, the like he only said that everybody has got different frequency, so going into specifics may not require. But I think he actually has covered a very
Yeah. Yeah.
broad outline of anyone who actually should take up. Actually, for that matter, not only for gastroenterology, I think we have given a really good interview for every other subject as well. Your
Exactly.
this thing can be a very
Correct.
good
Anybody.
outline.
Yeah. And he
Uh,
mentioned intent. That's very intelligent, because you have to believe that you'll be able to do it. Otherwise, everything else is peripheral. So you decided at one point that you were going to crack this, and you manifested that wonderfully. Congratulations.
congrats again, yeah.
thank you,
So
sir. Thanks a lot.
So best
welcome
of best
together.
of luck. Where are
Yeah,
you? So you have you decided where you're going to join?
what is the span of 24 minutes? Sir?
I will take a very rational decision after seeing everything.
Okay.
Sure, don't worry. We don't want to push you to reveal your cards here. Anyway, all the best, Shubham. Thanks for talking to us. It was really nice talking to you.
Thank,
And all the best for your future.
thank you. Thanks a lot. It
Thank
was a
you.
very
Yeah,
pleasure,
yeah.
sir.
Enjoy the feeling. We'll be colleagues soon. So
Yes.
we'll probably meet at
Yes, and
conferences and
the mentors first,
discuss.
after then colleagues.
No, once you are in this game, then we are all colleagues.
Yeah, you have come to the other side now.
Now you're on the other side now.
Yeah, you've
Okay.
broken
Yes,
through
sir.
the other side. how.
Take care. Okay, man. Nice talking to you.
Yeah.
Bye bye.
Thank you,
Bye
sir.
bye.